Supermajority in the Senate is now gone. Is the president's health care bill gone with it? Robert Gibbs is the White House press secretary. David Axelrod is the president's senior advisor. They're here for a daily rundown and exclusive together. We believe it's your first joint interview since you've been in that lovely...
It may be our last. Let's see how it goes.
We may take it on the road, Chuck. We may hit a few cities.
Fair enough. So, David, I'm going to put this first question to you. How much responsibility does the White House accept for Martha Coakley's, for the Democratic Party's loss in Massachusetts?
Look, Chuck, there's an unbecoming habit in this town of trying to defray responsibility, point in other directions. And so let me say, it was Robert's fault, and I'm bitter about it. No, look, seriously, I'll let others assess responsibility. I think the main thing that we saw in Massachusetts was the same sense of concern on the part of middle-class folks about the economic situation, about their wages being stagnant, about jobs being lost, about their economic security that's been in jeopardy. And this is something that predated the big recession that we're going through. And that's something that we have to pay a great deal of attention to. It is the focus of this president's attention at all times, and we have to convey that.
But David and Robert, how can you interpret this in any other way but that it is a total rejection of health care reform, given the fact that the candidate who won resoundingly would sign his autograph 41, the 41st vote against health care reform? How can you interpret it in any other way?
Well, I will just tell you this, Savannah. I think that there were a lot of elements to the message yesterday. Healthcare was part of it. I would note that Senator Brown didn't run one ad on healthcare in the entire campaign. I'm sure you know that. And he supported a healthcare reform similar to the one that the president was and is committed to in Massachusetts, and said during the campaign that he wouldn't repeal it. So I wouldn't make. There are messages here. We hear those messages, but there is a tendency in this town, not that you guys would do it, to overblow things even beyond their importance. And I don't think it's about that one particular issue. I think there's a general sense of discontent about the economy, and there's a general sense of discontent about this town. That's why we were elected. We are committed to doing something about it.
Now, Robert, in our NBC Wall Street Journal poll, we asked, sort of at this one-year mark, has the president accomplished a lot or a great deal or only some or very little? I was struck that a majority of the country doesn't believe the president accomplished a lot. Look, you guys have a lengthy list of legislative achievements. Clearly, health care is not one of them, but you have gotten a lot of things passed. Why do you think the public doesn't view it as accomplishing a lot in this first year?
Well, Chuck, I think for a lot of reasons, the first of which is change takes a long time to happen, certainly in this town, and it takes even longer for the American people to feel that. The president didn't have a first-year agenda. He has a first-term agenda. So while today marks the end of the first year and the beginning of the second, it's not even really a Hallmark holiday. I would say this, too, building off of what David said. There are things that the president has accomplished, whether it's a credit card bill of rights, whether it is a recovery plan that's led to the first quarter of economic growth in more than a year. That same sort of anger and frustration that the president saw when he traveled in Iowa and throughout this country for more than 2 years is still very pervasive today. I think that's what we saw most of all coming out of Massachusetts. Is there's a tremendous amount of anger and frustration about where people are economically and whether this town is fighting for their economic well-being or fighting for the special interest well-being. I think that's what's ultimately going to define more about the coming political battles and the upcoming election. Look, healthcare is an aspect of it, but this is far broader than that. There's an anger and a real frustration, people's jobs being shipped overseas. As David said, they're working harder, they're working longer, they're more productive, yet their wages are going down. That leads to the type of isolation and economic frustration that we felt for quite some time.
David, we're running out of time, so I assume you're not going to cede today right here on the Daily Rundown that health care reform is dead. So let me ask you, what is your next step? Are you going to ask the House to pass the Senate bill as is? Or are you going to try to jam it through the Senate fast, notwithstanding what Senator Jim Webb, a Democrat from Virginia, has said, saying that he thinks everything should stop, all action on health care suspended until the new Republican senator is seated?
Well, you're right, Savannah. I'm not going to discuss tactics here. I will say this. The president traveled this country for 2 years, and he heard from people all over this country about their struggles with the health insurance system. He believes that there's a real crisis, and that's part of what middle-class people are struggling with. He believes we have to deal with that crisis, but we also have to take into account what voters were saying yesterday, and what we've heard from folks around the country. We will take that into account, and then we'll decide how to move forward. But it's not an option simply to walk away from a problem that's only going to get worse.
Evan Bayh said if you don't hear this wake-up call, then he doesn't know what else can be done. Do you guys hear this wake-up call? Do you believe this was a wake-up call to maybe, whether it's to retool your message, whether it's to get your message out there better? Do you hear a wake-up call in what happened yesterday?
Look, Chuck, again, I don't think what Senator Bayh would argue is that we somehow abandon our pursuit on things that are important to the middle class, how to make college more affordable, how to make retirement more secure, how to create an environment for good-paying jobs in this country. Look, we won Indiana for the first time since 1964 because we understood the frustration, the anger that was out there, particularly about economics and economic isolation. We were with Senator Bayh in a lot of those events. I think we all agree that we have to work even harder on that and have the American people understand that the focus of the president's day from the very beginning to the very end is on their economic situation. He wakes up in the morning and he goes to bed at night thinking about how to make people's lives better, how to create that environment for creating jobs, how to get this economy moving again for real working people.
All right, Robert Gibbs, press secretary over at the White House, David Axelrod, senior advisor. Thank you for your time, and we appreciate that you seem to have coordinated your outfits this morning.
Yeah, well done.
Looking good there on the White House North Lawn.
Tough to deal with Robert's pastels. I know that, David.
I'm setting a high bar for him.
Hard to compete.
Thanks so much for your time.